Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Our topic today, brachial plexus. Brachial plexus. The brachial plexus is formed by the anterior rami of last four cervical and first thoracic spinal nerve. That means is formed by the anterior rami of 5 spinal nerve from C5 to T1. The brachial plexus located in the posterior triangle of the neck and in the axilla. It divided into roots, trunk, division, and cords. Here is the brachial plexus. The brachial plexus is formed by the anterior rami of the spinal nerve from C5, C6, C7, C8, and T1. 5 roots. And then 5 roots join together to form trunks. How many trunks in the brachial plexus? 3 trunks: superior, middle, and inferior, or upper, middle, and lower. And then the next is division. The division are 6. After division, the formation of the cords, which are 3 also. Okay, again, spinal nerve, cervical spinal nerve from C5, C6, C7, C8, and spinal nerve of the thoracic form the root of the brachial plexus. C5 and C6 join each other to form the upper trunk or superior trunk. The 7 cervical spine nerve pass alone to form the middle trunk. C8 and T1 join each other to form the inferior trunk or lower trunk. Next step is division. How many division in the brachial plexus? 6 division. That means the superior, middle, and inferior trunk, each one divided into anterior division and posterior division, anterior division and posterior division, anterior division and posterior division. So we have 6 divisions formed by the division of the trunk. Next step is the cords. How many cords in the brachial plexus? 3 cords: medial, lateral, and posterior. The posterior division join each other to form the posterior cords. The anterior division of the superior and middle trunk join each other to form the lateral cord. The anterior division of the inferior trunk pass alone to form the medial cord. So we have 3 cords: lateral, medial, and posterior. Okay, the branches originate mainly from the cord of the brachial plexus. From the root of the brachial plexus originate two nerves, which include dorsal scapular nerve and long thoracic nerve. Dorsal scapular nerve or nerve to the rhomboid supplies the rhomboid muscles and levator scapulae. Long thoracic nerve supplies the serratus anterior. From the trunk originate two branches, which are nerve to the subclavius and suprascapular nerve. No branches from the division. From the lateral cord originate three branches. From the posterior originate 5 branches. From the medial cord originate 5 branches. Okay? From the lateral cord originate lateral pectoral nerve, lateral root of the median nerve, and musculocutaneous nerve. Lateral pectoral nerve supplies the pectoralis major. Musculocutaneous nerve, this is the main nerve, supplies the anterior compartment of the arm. So, from the lateral cord, 3 branches: lateral pectoral nerve, lateral root of the median nerve, and musculocutaneous nerve. From the medial cord originate 5 branches, corresponding to the branches of the lateral cord: medial pectoral nerve, which supplies the pectoralis major and pectoralis minor. Medial root of the median nerve. This medial root joins the lateral root of the median nerve to form the median nerve. The median nerve supplies the muscle in the anterior compartment of the forearm and hand. Mainly the muscle of the hand supplied by median nerve. Medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, which is the cutaneous, supplies the skin of the medial part of the arm and forearm correspondingly. Ulnar nerve is a continuation of the medial cord, and it supplies the muscle of the forearm and hand. Posterior cord. The posterior cord gives 5 branches, which are upper and lower subscapular nerve, which supplies the subscapularis muscle. Thoracodorsal nerve, which supplies the latissimus dorsi. Axillary nerve, which supplies the deltoid and teres minor. Radial nerve, which supplies the muscle of the posterior compartment of the arm and forearm. Revise the branches again. This is the lateral cord, gives 3 branches: musculocutaneous nerve, lateral root of the median nerve, and lateral pectoral nerve. From the posterior cord give rise to the axillary, radial, upper and lower subscapular nerve, and thoracodorsal nerve. From the medial pectoral nerve, medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, medial root of the median nerves that join the lateral root to form the median nerve and continue as ulnar nerve. Okay? Again here, the brachial plexus is formed by the anterior rami of the cervical spine nerves and the first thoracic spine nerve. So it is formed by C5, C6, C7, C8, and T1. Okay? C5 and C6 join each other to form the upper trunk. C5 continue alone as the middle trunk. C8 and T1 join each other to form the lower trunk. Next step is the division. Each trunk divided into anterior division, posterior division, anterior division, posterior division, anterior division, and posterior division. The posterior divisions join each other to form the posterior cord. The anterior division of the upper and middle from the lateral cord. The anterior division of the lower continue alone as the medial cord. Variation. The brachial plexus may be originate from C4 till 210. This is named as prefixed brachial plexus, and also may originate from C6 to T2, and this is known as postfixed brachial plexus. Okay, injury to the brachial plexus. As you see here, this man fall on his shoulder, and this falling lead to increase the angle between the neck and shoulder, and this baby pulled by midwives and also increase the angle here between the shoulder and neck, and this lead to the injury of the upper trunk of the brachial plexus. And the patient here characterized by waiter tip position. The upper limb hang by the side and in medial rotation position. This position known as waiter tip position. Opposite to it, injury to the lower trunk of the brachial plexus. This man fall from the tree and try to fix it, and this baby pulled by his hand by midwife, and this lead to the injury of the lower trunk of the brachial plexus. And mainly here, the muscle of the hand will be affected and lead to the claw hand. The hand is partially flexed and known as claw hand. Thank you very much.